We're in our part 3 of the series on ADHD and schema therapy. And if you haven't watched part 1 and 2, you'll be introduced in part 1 to the case study of Ellen, which Dr. Shapiro will be talking about with us in this part as well. But let's jump in now and hear him talk again about the kinds of really common unmet needs that occur for people who have undiagnosed ADHD as children. And then, as we know, when needs are not met as children, we develop coping modes.
And I think Ellen needed this, the support of you realizing that there's some struggling, perhaps getting some assessments, speaking with her teachers, perhaps getting additional support from tutors, and really finding out what's going on and helping her to know that she's not alone in this. She's a little girl. She's very young. And to
So there's a lot of
imagine
unmet needs there, aren't there, in terms
a
of
lot of unmet needs, yes.
yeah, a sense of acceptance, understanding, protection from criticism, undue criticism, guidance, direction about where to go to get the support, like a lot of unmet needs in that
A lot
scenario.
of unmet needs. Imagine, and this isn't that uncommon, but imagine that a child isn't doing that well in third or fourth grade. And finally, in sixth grade, the school nurse does a screening of all the children and finds out, and that what was really going on all that time was that they needed an evaluation and to get glasses or to sit closer up in the classroom or to figure out what was going on with their hearing. So it's really no different than any other neurological or medical issue. I just want to really emphasize that people's symptoms can sometimes be seen as a schema or coping mode and actually be the ADHD, or could be actually the ADHD and initially perceived as a schema mode or coping strategy.
Can you give an example?
Someone that has ADHD may really be struggling with getting, for example, their hours in. This is something that all lawyers hate doing at the end of the month, keeping track of their hours. And they may keep struggling with keeping track of it on a daily basis, adding them up at the end of the month and turning them in on time. And so someone may interpret that as insufficient self-limits or not wanting to follow the rules. And it actually may be someone with severe ADHD who's really struggling with something that's very detail-oriented.
Mm. And the other way around, where someone may think it's ADHD, but actually it's some schemas and modes playing out that need teasing apart.
Yeah, I was telling you about someone who wanted to work at the highest level of performance as he viewed everyone else in his company working. And he wanted to be able to do that at all times. And that wasn't really ADHD. What was going on was unrelenting standards, wanting to perform above and beyond what was realistic and possible.
So the explanation of I can't meet those unrelenting standards is I must have ADHD. So that
There must be something wrong with me. And if I only had that treated, then I would be number one at this company because I really am that intelligent and that insightful about this company.
gotcha. Yeah,
And
that's what.
sometimes it's not either or. I would say in the majority of the people that I see, it's this overlap. It's this, I use the word Venn diagram over and over again with my clients, or I draw the circles, that it really is often this overlap between the schemas, the coping modes, and the ADHD.
Mhm.
It's very interesting about ADHD in terms of the DSM-5 criteria. That's only the tip of the iceberg. That the biggest reason people struggle in the workplace is really due to executive function, which is not even in the criteria of ADHD, but we know from the research that the majority of the time, people with ADHD also struggle with executive function. And executive function is the ability to have emotional regulation, planning, strategizing, prioritizing, being able to stick to something day in and day out from the beginning of a project right through to the end. And the medications aren't going to really help that. They help with focus, they help with distractibility very effectively, but they're not great in terms of treating executive function. And what treats that is really good therapy.
I think it's important too, Scott, just kind of going back to what you said in another 7-minute schemas, is kind of supporting people to understand what that looks like for them. So one of the things that gets in the way of identifying or achieving goals around that passion is a failure schema that's been shaped over the years because of feeling as though, in comparison to other people, I can't do X, and I'm getting all these messages about how I'm not good enough. And so again, really kind of targeting those core schemas will try and help shift into reconnecting with that passion around what's important.
Absolutely. And as we know, it really takes day in and day out at chipping away at those schemas and those coping modes in between sessions. And so when someone wants to start their own business, or they want to go to grad school, or they want to start a family, and they worry about having a failure, for you to work, for us to work on it during the sessions on a deep experiential level, and then also having them work on it outside of the sessions, and for them to notice when that failure schema, that failure mode is coming up.
We're at 7 minutes and we have to finish up, but I feel like we should plan ahead and maybe have some 7-minute schemas on how the perfectionistic over controller plays out in ADHD and some of these other coping modes where we've done 7 minutes, but looking at them a bit more specifically to ADHD. That could be something that we could get together and do more of. So stay tuned.
That would be a lot of fun. That would be a lot of fun.
All right. Well, one last word, perhaps to the person who's watching and maybe, has a diagnosis or suspects that they may have ADHD, who may actually now feel very overwhelmed by all this content. What would you want to say to that person, Dr. Shapiro?
So I would say it can be very hard to find a therapist, a psychologist, or a psychiatrist who specializes in adult ADHD. And you may be working with someone who doesn't, quote, believe in the diagnosis. So if you suspect that you have ADHD, it may take some persistence and some perseverance in terms of finding the help that you need. And also being open to the idea that this may be ADHD or it may not be. But if you have a high suspicion, if there's a family history, because this runs in families, to be persistent and to have the perseverance to find the help. And I would also say that actually, as many of you who are watching who may have ADHD know, ha being like a terrier dog, having that persistence and perseverance is often one of your gifts.